Yeah, just to introduce our speaker tonight, this is Charlotte Gerarda, and Charlotte is our Policy and Public Affairs Manager at the Huntington's Disease Association. And tonight, Charlotte's going to talk to us about what the HDA has been campaigning about, and also some ideas about things that you can do to help us with those campaigns. So Charlotte, is it okay if I hand over to you? Do you want to share your screen?
Thank you. Hi, everybody. Thanks very much for the introduction. So this session tonight is an introduction to policy and public affairs. And we thought this would be a really good session to run because we've got quite a few sort of different policy asks and campaigns going at the moment. And my role is a new role. I've been in it since August of last year. But yeah, we just thought it'd be great to sort of explain a bit about what it is that policy and public affairs is about, and also, most importantly, how you can get involved as members of the Huntington's disease community. So firstly, what is policy and why does it matter? So a sort of simple description is a policy is a set of ideas or plans that is issued as a basis for making decisions, especially in politics, economics, or business. So essentially, policies are the solutions to the problems that we see within the Huntington's disease community. And the best policy recommendations come from evidence and from the bottom up. So that could be from our specialists, Huntington's disease advisors across the country, members sharing information with us. But in an ideal world, to develop policy positions, we need research, and that can be primary or secondary research. So having policy positions really matter because when we lobby politicians or government, we can't just outline the problems and, talk about the things that don't work and complain about what we don't like. We also need to have solutions about how we would prefer things to be, to have these ideas. And as a charity, something we can do is save the government time by presenting policies that tackle issues and challenges. So essentially having off-the-shelf policies that any government could pick up and run with and know that this would improve health and social care outcomes for people with Huntington's disease or other neurological conditions. So what are our top 5 policy asks? So these have been our policy asks since I've been in post. I'll give you a bit of an update on where we are with all of them in a bit. But the top 5 are access to community mental health services when psychiatric symptoms are present, because we know that many people who have Huntington's disease are being excluded from mental health services. A Huntington's disease care coordinator in each local area to ensure people can navigate the many professionals they need, and those professionals have knowledge and understanding of this disease. Specific NICE guidelines for Huntington's disease to ensure there is consistent care for this complex illness. A review of the blanket refusal to entry to the armed forces unless someone at risk has had a negative predictive test. Uplifting of benefits to reflect inflation, as many people with Huntington's disease have higher energy and nutritional needs. And this campaign has been won, and I'll explain a bit about that in a bit. So what is public affairs? Public affairs refers to the engagement between businesses or organisations and government bodies. Similar to public relations, strategic communication is at the heart of public affairs. So at its core, it's about lobbying politicians and influencing government at all levels. So that's local, regional, and national. At the moment, our primary focus is nationally at Westminster, because this is where the government bases its policies, the law, where funding is decided and key decisions are made. But we're also lobbying NICE at a national level, which is obviously different to a political target. Our primary focus regionally is with what's now called integrated care systems, ICSs. So these have been set up to commission healthcare services in each area, and they've taken over the role of clinical commissioning groups. So essentially they do the strategic and commissioning sort of oversight across different areas. So are really important to focus on. Our primary focus locally is with MPs, where we have been asking members to engage with their MPs as constituents to raise issues and concerns and resolve issues through casework. So there are lots of different areas that we could be targeting, but based on what our main policy asks, these are our kind of key targets at the moment. So why does public affairs and campaigning generally matter? So as part of our jobs, we support the Huntington's disease community every day, and we see patterns in the challenges and issues that people face. So to tackle those barriers to access support for our members and secure the best quality of life possible, we need to raise awareness of those issues and campaign for change. So it's about improving access to services, giving people the best quality of life. Those living with Huntington's disease experience a wide range of challenges beyond the fact that this is a complex condition. There is severe issues of discrimination and disadvantage compared to other conditions that we want to change. So by campaigning as a collective, we can strengthen our voices and influence outcomes. Sometimes legislative or policy change is required at the national level to secure the outcomes that we want. And again, based on what are kind of the key issues that are coming up time and again, that really sort of guides where our efforts need to be focused, and much of it is at the national level. So how can we influence at the national level? So we can directly engage with relevant government secretaries of state and ministers to influence their policies, bills and funding priorities. So a primary target for us is the Secretary of State for Health and Social Care, but also the other ministers within that team. Directly engaging with the opposition, including with relevant shadow secretaries of state and shadow ministers to influence their policies, bills, and to hold government to account. So the shadow team basically mirrors all of the different political sort of leaders within the government. So engaging with them is also very important because, yeah, they will scrutinise the government, and also we have an election coming up probably next autumn. So, you know, now is the time for us to be influencing, you know, all of the political parties and influencing their manifestos. We can also map politicians who have an interest in supporting us based on their political interests. So there are lots of, literally hundreds of what's called all-party parliamentary groups. These are different groups that have been set up and they have a particular theme and they focus on a particular issue. So there's literally an all-party parliamentary group on pubs, coasts in the south of England, rare diseases, which is obviously more relevant for us, but literally a ton of topics, and there's lots of health-related ones. There are also committees as well that have a sort of balance that is representative of the makeup of MPs in Parliament. So, for example, the Health and Care Committee is relevant for us. And also we can see what questions MPs ask in Parliament. So if there are MPs that are asking lots of questions about neurological conditions, then we could reach out to them and introduce ourselves. So asking politicians to raise parliamentary questions on different issues and topics is really, really critical. And we're really lucky now that we have quite a number of MPs who are very keen to ask parliamentary questions for us whenever we would like. MPs can initiate debates such as Westminster Hall debates, early day motions or opposition day debates, and we can brief politicians ahead of any relevant debates. We can hold events in Parliament for politicians to drop into, such as the one that we had during Huntington's Disease Awareness Month, where we had about 32 MPs attend, which was brilliant. And we can also use petitions, emails, letters, and briefings. How can we influence at the regional level? What we've been doing quite extensively is mapping the integrated care systems across the country to get a better understanding of the level of services in each area. where the gaps are and where improvements can be made. So here a critical sort of part of this mapping exercise were our specialist advisors who across the country have been giving us a lot of intel about where services are good, where gaps are, where there's no services at all, where things are really bad. That's been a really important exercise. We've then been contacting the ICSs where there are poor levels of services or where services can be improved, with the request to meet to explain how things could be improved and made better. So it's a really core part of the integrated care systems to engage in more preventative work, engage more with the voluntary and community sector, and to tackle things like inequality of access to health services. So we're kind of using their priorities as an organisation to encourage them to meet with us. And so far, we've had a really, really good take up of the ICSs that we've written to. Ultimately, our aim is to meet with representatives to explain the challenges members of the community are having in accessing the services they require, and provide ongoing support and expertise, including pitching for contracts to deliver services and also to shape service delivery plans. So where we know that services are operating well and we have models of excellence from across the country, we can share, you know, why particular services are working well and models that can be shared across the country. So it's really important work. How can we influence at the local level? As part of the Huntington Disease Association's evolving policy and public affairs work, we are engaging with MPs at the constituency level. So this is a form of soft political lobbying that MPs are more likely to take up as it relates to their local constituents. So the sort of constituent MP link is really important because MPs they have a sort of duty to engage and respond to the issues that constituents raise with them. Whereas when a national charity contacts them who isn't in their constituency, they don't really have any obligation. It's just down to whether or not they're interested to meet us or not. But the constituent has, you know, quite a lot of power in, you know, making them aware of any issues and to ask for their support. You know, they have a duty to respond. So engagement can take several forms. So MPs could visit a local HDA branch or group. MPs could be invited to events organised by us as a charity. Members of the Huntington disease community could attend an MP's constituency surgery. Every MP periodically holds a constituency surgery, and this is a place where any constituent can go along and raise any issues and ask for their MP support. Every MP holds these differently, and you can normally find out information about your MP's surgeries on their website. So it's always a good starting point to just see. Some will have a kind of drop-in location, others you'll have to book in, but that is really, really worth doing. So we have been trialling this approach in Hampshire and Isle of Wight. We had a meeting with Stephen Morgan, MP for Portsmouth South, and he invited not just constituents actually, but members from other parts of Hampshire and the Isle of Wight to discuss issues with him. So through building relationships with MPs at the constituency level, we ultimately help to increase awareness of Huntington's disease and the challenges the community is facing among politicians. We share policy solutions in an indirect way, using this as a lobbying opportunity. We diversify the pool of MPs that we build relationships with. We build positive working relationships, so we get more support when we have campaign asks or specific issues relating to a HD community member. And ultimately, we're empowering the HD community to share their ideas and views with decision makers and be part of the process to influence national policy. So all of the support from members contacting their MPs recently with the various asks that we've had, whether that's attending our parliamentary drop-in event or contacting NICE to request NICE guidelines, we have had a huge array of support from different MPs. And actually, I counted it up yesterday, and we we essentially have relationships with 139 MPs and Lords and Baronesses at the moment, which is incredible. It's really, really good to have that level of engagement. And a large part of that is because of members contacting their MPs at the constituency level. So it's really, really powerful. What are the main public affairs resources and tools? So as an organisation, we are subscribed to a parliamentary monitoring service run by a company called Randalls. They basically save charities and groups a huge amount of time, because they do like a daily briefing and update on everything that's happening in Parliament, and it helps you to horizon scan and see if there's any opportunities coming up that you can kind of jump on that are relevant to what we're focusing on as an organisation. Hansard is the official report of all parliamentary debates. So if you didn't have an opportunity to watch a debate live, you can go back on Hansard and literally look up every previous debate, and it is typed out verbatim, so you can see what each person has said. So that's a really good place to look. They Work For You is a really helpful website that shows you how politicians have voted on certain things. So say if you were curious about how your MP had voted on health and social care, you know, if they voted to invest in health and social care, it would literally tell you that and everything else. We develop briefings on different topics that outline the issue, the problem, the need and the solution, with evidence, data and case studies to back it up. And we use those briefings when we meet with MPs to give them an overview of a particular issue and what we see the solutions as being. We also build and maintain relationships, which is critical to good public affairs work. That is basically the core of what public affairs is. The more positive relationships we develop, the more we can influence and the bigger changes we can make. So that's really critical. What are our priority campaigns? These are the ones that we've had ongoing since I've been in post. So the first one that I worked on was the cost of living crisis. So through collaboration with other organisations, we successfully secured additional funding for people with disabilities, people on low incomes, and the uprating of benefits in line with inflation from April 2023. And then a later freeze to energy bills for another 3 months, because we supported a campaign that Martin Lewis was running this spring, which over 100 charities joined. So although for now we kind of achieved our initial aims with this, we will need to keep an eye on it and continue to campaign for additional support for the Huntington's disease community, in particular going into this autumn and winter, when there's less certainty about what support the government will be providing for people. And obviously the national picture with the economy and inflation is not very good. So yeah, but we'll have to keep a watching brief on that. Then mental health service exclusion. So through collaborating with the Neurological Alliance, we are researching the extent to which members of the Huntington's disease community are denied access to mental health services, with a view to stopping this from happening. So there's two parts to that. We've had our own surveys running of both professionals and also family and community members. Those surveys have now given us really good evidence about the exclusions that are happening. That's enabled us to have a briefing that we've now circulated to quite a few MPs, and we're now sort of hashing out a bit of a campaign plan around that. And then the other part is we are submitting freedom of information requests to mental health trusts across the country to try and see if Huntington's disease, or more broadly neurological conditions, which are known otherwise as organic brain disorders, if they are basically being, patients with these conditions are being excluded in eligibility criteria. We do know of some examples across the country where this is happening, and we want to see the extent of it. So we will be contacting every mental health trust at some point soon. The next one is around the introduction of NICE guidelines for Huntington's disease. So last November, we held a Westminster Hall debate on Huntington's disease, which was led by our parliamentary champion, Hilary Benn, MP. And a key ask was to introduce NICE guidelines. That's something that was raised there. And the really brilliant thing about the Westminster Hall debate is that the government sends along the relevant minister. So in this case, it's Helen Whately, who's the Minister for Social Care. And she has basically been working with us behind the scenes to try and essentially lobby NICE to introduce guidelines for Huntington's disease. So the minister did present a briefing, which we provided information for. And then a couple of weeks ago, NICE had a meeting to consider NICE guidelines for Huntington's disease. And we let members know about that. We emailed everybody, put it out on social media. Many of you wrote to your MPs and asked them to contact NICE to also, let them know that they think guidelines for Huntington's disease would make a big difference. Unfortunately, we've only found out this week that they have declined to prioritise them at this stage, mainly because they see that there are a number of other guidelines that are relevant to Huntington's. But we know that despite other guidelines existing, the services across the country are very, very patchy, and actually the standards of care are low. So we won't give up. We're having a bit of a rethink of things. We've got a few kind of important meetings coming up, and we'll keep everyone updated. Influencing integrated care systems. So ensuring Huntington's disease is understood and supported with a multidisciplinary approach. So that's ongoing. We've met with about 4 different integrated care systems now, and we've just written out to a couple more where services are patchy, and we're waiting to hear back from them about meetings, which is really good. And then the last one, exemptions from armed forces. So just changing the discriminatory practice of preventing anyone at risk of HD from serving in the forces unless they have a negative test. So we've asked a number of parliamentary questions about this. There's been quite a few letters that have gone to the Secretary of State and Minister for that. And this sort of questioning on that part is ongoing, basically. So what can you as members of the Huntington's disease community do to support our campaign work? So if you're experiencing any issues or challenges, do contact your local MP to ask to meet with them. MPs get contacted about a whole variety of things, and a lot of the time it's just to ask them about, what their view is on X issue of the day. But actually what MPs are there to do is to advocate for constituents and to support them, particularly if you're having a difficult time, whether that's with a local council not giving you access to services that you need, or if you've hit a brick wall with getting continuing healthcare or access to mental health services. All of those kinds of things, your MP can help with that, and they can advocate for you. And although MPs don't have a sort of legislative mechanism or an enforcement mechanism, often getting a letter from your MP with a few stiff words does get things moving, and they can make a really, really big difference. So do contact them if you're having any issues. If you have any responses from your MP or actions they've agreed to take, please let us know, because we have a sort of database of all the MPs and lords and baronesses that we've ever contacted. And we like to sort of keep tabs on who we've got some kind of engagement with. So please let us know. When we have campaign actions, ask your MP to get involved. Many of you have been fantastic at that. And yeah, we're really grateful for all of your support, particularly in the last few months with asking your MP to do various things. So thank you. Share stories about the issues and challenges you or your family are facing. Your stories are so powerful, and they really help to illustrate what we are describing, in terms of the sort of findings from research and that sort of thing. But stories are what really move people and get, motivate them to do things. So please share them. If we have surveys circulating, I know that people can get survey fatigue because there is a survey going around probably every other week, but please do complete them, because the data we gather is used to build an evidence base to lobby politicians with. It doesn't just go into nothing and go nowhere. We use that evidence, and it's incredibly powerful. So thank you for responding to our surveys, and please do keep doing that. And please also help us with collecting case studies. So if you have a particular example of, where services have been denied or where you've hit brick walls continually, then we can turn your stories into case studies, which again are really powerful, particularly when we meet with politicians. Hey, that's the end of my presentation.